Hi, I'm Elizabeth Hess, and this is the 38th information session that I have conducted with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Hi, Julie.
Hi, how are you?
I am bracing myself for a very long holiday season and long winter. Let's start right now with the fact that Champaign County, we've done well on the campus. Outside of the county, not so much. Tell us about the numbers right now.
Okay, right now we are at 1,219 active cases. We have 12 Champaign County residents who are hospitalized, but the hospitals are much fuller than that. We only report those hospitalized from Champaign County. We have had 46 deaths. And right now our county has a 9.7% positivity rate and our region a 14% positivity rate. And let's see, our hospital capacity, and this is, I think, what people need to start really paying attention to. Our hospital capacity for our 21 county region is at 29% right now. That means that they have 29% capacity in the hospital itself. And also it just happens to be 29% for the ICUs right now. In our region, there are 53 ICU beds remaining. So, we're at that point where what people do over the next weeks are going to really matter. And what we're really concerned about, of course, is people continuing to travel and gather and have weddings and just act like we do not have a pandemic. And we will quickly see those beds be used.
Before we get into Thanksgiving and how you and the CDC strongly recommends against congregating, let's try to have a little bit of glimmer of hope. Okay, let's talk about some of the vaccines that are happening right now. According to the Food and Drug Administration, there might be a vaccine for frontline workers in the next month. It takes 2 doses. So how does that work? You get one 28 days later, you get a booster, and then how does the herd immunity come in from there? Can you kind of explain the process?
Well, it's going to take quite a while before we get enough, immunity. So the vaccines are looking good, and all the ones, the mRNA vaccines that are coming out, they all seem to have really high efficacy. But I think I probably need to explain to people a little bit, what that means. So you're right. When we first get them, all the vaccines are going to go right off the bat to those most at risk. So that is going to be your frontline healthcare workers. Those are going to be the people, or it can also be, people in maintenance working in hospital rooms, but it's going to be anyone who is exposed to people who are known to be infectious. So that's your healthcare workers, your people that work in the hospitals with doing direct client care or working in rooms with clients. That's going to be convenient care staff, places that work directly with clients who are sick. And then it will start branching out from there. But what's going to happen is as soon as we get the vaccines, they will go to the places that are already predetermined so that they will start getting the vaccine in. But I think I need to talk about vaccine efficacy a little bit because there seems to be some confusion out there. So can you humor me on this for a minute?
Please.
Okay. So let's just use the Pfizer example. So Pfizer had 43,600 and some people that were recruited for the study. Then how it works is half of them are given the vaccine, half of them are given the placebo. Then they wait until 170 of them get symptoms and then test positive for COVID. And once that happens, then they unmask the data and then they look at it and they say, of the people who got sick, of the 170 who got sick, were they vaccinated or did they get placebo? During this study, only 8 of them had been vaccinated. All the rest of them, the 162, had received placebo. So those are very, very encouraging results for those vaccines. But we also need to make sure that people know that that is a trial. That's a trial. It's not real world. So what does it not tell us? It doesn't tell us if there were any people in the study who were vaccinated but were asymptomatic. So maybe they were asymptomatic, maybe they were spreading it, we don't know. because the study was designed for when people got symptoms, then they got tested. So if you happen to be somebody who had asymptomatic infection, you might not know that. How will the vaccine work in the real world? Because, I was one who signed up for the study, and there are just a certain types of people can even get into the study. So you have to be, a certain age, you have to be healthy, you have to be, you have to meet all the criteria. So the study groups for trials are not the same as, let's just say, a randomized sample of the entire US population, for example. So we still wonder, like, how will it work in other populations, people who are sick, people who have immune compromised, issues, things like that. And then the real questions that we're concerned about right now is how quickly can this vaccine be deployed? And, we know it can be manufactured pretty quickly. How long is it going to take throughout the US to get it deployed? And how many people will actually take it? Because all of those things affect, how important or how effective a vaccine is, because the vaccine is only as effective as the vaccine program, as they say. So, you can have a wonderful vaccine, but if no one takes it, or if it doesn't get around to, everybody, that all plays into the herd immunity. So we all need to be planning on getting the vaccines as soon as we can, as soon as we're eligible, but also just know that you're going to need to be continuing the masking and the distancing for quite some time.
Well, as a follow-up, let me ask you this. I am obviously going to get the vaccine. I am pro-vaccine. Let's say my next door neighbor isn't. She is an anti-vaxxer. Does that still not protect me, or will it protect me? Her choice not to have it won't affect my health.
It depends on how many people don't take it, of course, but your vaccine will, assuming that you get the vaccine and it works properly, just like any vaccine, it will help protect those who don't get vaccinated. But as you know from previous outbreaks, once you get a certain percentage of the population that's not vaccinated and you lose herd immunity, then you can have breakthroughs. You can have outbreaks from those.
Okay. The CDC and the White House have not seen things at the same level until recently. Now everyone is realizing that masks and social distancing are the most effective ways. For the first time in 4 months, we heard from the coronavirus task force from the White House. At this point now, in order to stop the spread, do you think we need to have a national mandate for mask wearing? Is that the next step?
Possibly, but let's not forget that we've had a mask mandate in Illinois for quite some time. And, again, Champaign-Urbana does a great job with that. But once you get outside of Champaign-Urbana, or when people come in from other places to Champaign-Urbana, you'll see that it's not that great. So what would be wonderful is to have everybody in the country doing following the same guidelines that are based upon science, and then have the messaging coming out the same everywhere. But, I don't know. We are kind of just where we are at this point. But yes, everybody needs to wear the mask and distance from others. That is the only way that we're going to, keep people protected. But what people need to understand is you're not just going to get this, virus if you happen to be out, at the grocery store or whatever, because what you're doing there is you're out, you're moving, you've got hopefully your mask on. Everybody else has their masks on to keep any, virus contained. And what people are doing, though, is meeting with family, meeting with friends, continuing to have weddings, continuing to have birthday parties, actively seeking out places that are going against the guidance. So that's where, people are getting infected. And it just keeps happening. And it's very, very frustrating, because like I've shown on graphs, over and over, and, pictures that we put on there of little graphics that shows that the one case that you pick up at a wedding, or the 10 cases or the 50 cases that happen at a wedding, those just keep going out and out and out. And ultimately people die or are hospitalized who had nothing whatsoever to do with that wedding.
So 50% of people are asymptomatic. when they have COVID or are able to spread the virus.
Oh, yeah, able to spread it,
They're
but
able to spread the virus. So let's say that I show up at a Thanksgiving dinner. I had a negative test on Tuesday. I show up 2 days later. I'm asymptomatic. But then on Saturday, I start having fevers and chills. So now I have, and I have COVID. So I have potentially exposed everyone that I've been in contact with, even though I'm going into this dinner saying, hey, I have a negative COVID test.
yes, you have exposed everyone that you were at that dinner with. So assuming that it's a regular Thanksgiving dinner, nobody is masked and distanced and, it's inside, then you will have exposed everyone in that. And then they will have, in turn, exposed other people. And it's, and then you just kind of have to sit there and wait and see what happens with that. And unfortunately, there have been a lot of very tragic stories associated with just such things, whether they're weddings or parties or, whatever, family dinners, anything like that.
We've seen the airport pictures that are absolutely shoulder to shoulder with people. First of all, why are people traveling in airports? And when they get to their destination, shouldn't they be waiting 2 weeks and self-distancing? And I mean, how is this going to work? Why are people still traveling?
It isn't going to work. I don't know. They're traveling because they're being allowed to travel. And they're basically making poor decisions. And that's it. That's the extent of it. They should not be traveling. But they're allowed to. So, of course, people are still doing it. And, the 2 and 3 weeks after Thanksgiving, I think that we're going to see some absolutely horrific, scary and tragic hospitalization and death rates. And, there are parts of the country right now that are already, their hospitals are already overwhelmed. And it is only going to get worse. And again, I cannot stress this enough. The hospital and healthcare resources in our country are finite. They are limited. There is only so much you can do. Even if, you build a gigantic, field hospital in every state, the fact is you have to have healthcare providers staffing those beds. And that is a limited number out there. And they are getting worked to death right now. So it is not good.
Let's talk about a timeline. So 2 weeks after Thanksgiving, you're predicting that we'll see a spike that will fill up ICUs and ICU beds. And then just in time for Christmas, people will continue to congregate and travel again. So when will we be able to come up for air and actually have a break from the numbers of spiking? Mid-January, or we don't know?
We don't know. We don't know. These cases are going to spread and spread and spread. And, 2 to 3 weeks, again, you have infection, then later you have symptoms, and then hospitalizations and deaths are what we call a lagging indicator, meaning that they come quite a bit after the event. So 2 or 3 weeks after the event, you start seeing, a big increase in hospitalizations and deaths after that.
Recently, remdesivir was proven not to be as effective with COVID-19. Are there any drugs that are soundly effective in combating COVID-19?
Well, that is always a clinical decision on what is used, but I can tell you that, locally our hospitals are always as up to date on every single thing that they can be. And that's why, that it is important where you get your care. And that's always the case. But, certainly Carl and OSF are going to be keeping up on everything. And I know locally they're using like a multi-drug approach with symptoms and complications and underlying conditions and everything. So, I would certainly trust the care that I would get here. I do not keep up on what is the best drug. That is way out of my area of sphere of influence, if you will. But I do know that our healthcare providers do keep up on that. And it does change. I mean, they're using emergency use authorizations on a lot of stuff. So that means that it's coming out. And then they may find out that it's not as effective as they had hoped. And then they will maybe move on to something else. But I do know that locally they do use like a multi-drug type of regime.
You mentioned the 2 local medical facilities. And I want to circle back to something you said earlier. You gave the numbers for Champaign and Urbana residents. Are a lot of the people in hospitals that we're seeing now checking in from the rural areas and the surrounding communities? They're not from our local community here?
Yes, I know that, last week at one point, there were like 89 hospitalizations locally. And maybe 10 of those, I believe, were from Champaign County. So yeah, they have large catchment areas. And, the smaller hospitals are going to fill up really quickly. If you listen to some of the stories around the country already, and I certainly hope that we don't see that here, but what they're seeing, in other parts of the country, is that the hospitals are filling up. And then people, they're turning ambulances away. So the ambulance may have to drive 2 or 3 hours to get somebody to a hospital, which you can imagine that that's not the best scenario, because, you're having a heart attack, or you're having a stroke, or you're having, asthma attack or whatever. That is not good. And also they are, the hospitals are filling up, and then they're trying to move people into the larger city hospitals. But again, there's only so much capacity.
Before I let you go, a reminder for how to stay safe while we're coming into this holiday season. What can we do? Just stay home and mask? Is that right now? Sit tight, wait?
The main thing to do, is what you hopefully have been doing all along, and that is stay with your household, or your cohort, because some people bring in other people to their cohort. Let's say somebody who I don't know, another family member who maybe lives alone or something. But that has to be the group that's always been together, and not bringing anyone else in there to, in case you have a positive case in there. But, stay home. If you're going to do a Thanksgiving meal and you want to have your other family involved in it that live other places, use Zoom and things like that. I know that those are certainly not as gratifying as having your family around or cooking for your family or whatever, but it's certainly better than the potential alternative of bringing people together.
All right, Julie Pryde, Administrator of the Champaign-Urbana Public Health District. Always words of wisdom. A belated happy birthday from last week to our producer, Jason Liggett. Happy belated birthday to you. Diane Marlin, thank you so much. And I just want to give kind of a side thank you to Piatto Cafe and Urbana Staple. They have 500 orders for Thanksgiving Day because people are listening to you, Julie Pryde, and having them make Thanksgiving dinner instead of leaving and going to spend it with families. So there are some great businesses out there that we should be supporting and that are listening to your Eat It. Julie Pryde, thank you so much for everything that you do and everything that you say.